Hi there. Welcome, everyone. Good afternoon. Welcome to True Health's first Facebook Live event regarding Let's Talk About Sex. This is the first of three events that we will be having. We hope to see you at our next two events, which will be May 24th and June 21st. Before I get started, I just want to go ahead and put out a small disclaimer. The information provided by the presenters on this event is for general information purposes only. Of course, all the information is provided in good faith. The topics and/or pictures discussed today may be sensitive to some, so discretion is advised. Also, I want to let you know that all the participants will have an opportunity to enter a raffle and win a $50 gift card. And all you need to do is complete a short survey at the end of this presentation. So with no further ado, I will go ahead and introduce our PrEP team. You're going to hear the word PrEP interchangeably today, and PrEP stands for pre-exposure prophylaxis, and it is a medication that is offered to individuals that are high risk to prevent them from getting HIV. So with no further ado, my name is Dr. Luisa Mena, and I am the medical director here at True Health. And I will kick it over to Bernadette.
Hello, everyone. I'm Bernadette, HIV case manager for True Health, and I work closely with the PrEP program. And next up, it would be Jafet.
Good afternoon, everyone. My name is Jafet Rios, and I serve as Regional Director of Operations for True Health. I will kick it over to Mr. Giovanni Roland.
Hi, my name is Giovanni Rolón. I am Center Manager for Lake Underhill location. And I will be talking to you guys about HIV statistics. I'm going to kick it over to Gil.
Good afternoon. My name is Gil. I am the Community Outreach Specialist here at True Health. What I will be talking about today would be the misconceptions and myths of HIV PrEP.
Thank you, Gil. Thank you, everyone. So right now, we're going to go ahead and get started with our presentation with Jafet Rios. Jafet?
Yes, ma'am. And again, good afternoon, everyone. It's truly a pleasure to be on this presentation with you all. If you don't know, True Health is a nonprofit healthcare organization designated as a federally qualified health center here in Central Florida. For the past 46 years, our mission has been to provide high quality, comprehensive healthcare at a reasonable cost to everyone. We accomplish this mission by providing life-changing care to over 48,000 individuals, regardless of their individual circumstances. Our vision is healthy communities through life-changing care. Throughout Central Florida, we have 8 locations in total, 4 in Orange County and 4 in Seminole County. Within Orange County, we have our Alafaya Bay site, which is located near the Waterford Lake community. We have our Hoffner location near the Orlando International Airport. We have our Lake Underhill location in the intersection of Lake Underhill and 436, and our Southside location located 10 miles from the Florida Mall. On the Seminole County side, we have our Sanford location located within a 10-minute drive from the Sanford International Airport. We have our airport location located inside of the Seminole Health Department. Our Harvest Time location located inside of the Harvest Time International Facility and in Sanford. And then last but not least, we have our Castleberry location, which is located on the 436 corridor near Howell Branch. Our services include primary care for both adults and kids, podiatry, lab work, pharmacy, obstetrics and gynecology, optometry, behavioral health, psychiatry, dental, x-ray, and our outreach and enrollment team who specializes in providing in-person and telephonic enrollment assistance in the Medicaid, KidCare, and federal health insurance marketplace. Okay, that's a little bit about True Health, and I will take it over to our next speaker, Mr. Giovanni Roland.
Thank you, Jafet. Giovanni?
Yes, hi. I'm going to be talking to you guys about the HIV statistics. If you guys can move over to that slide, that'd be fantastic. Next slide, please. Awesome. So basically what I'm going to talk to you guys about some basic knowledge on HIV and just talk about the rates and kind of the exposure around HIV in the state of Florida. Some of these statistics are going to be specifically to Central Florida, where we are located. So we know that about 117 people live in Florida with HIV who are HIV positive. Of those, about 13,000 live in Central Florida. When we look at it by genders, we know that males occupy 76% of the scale and females 24%. When we look at it by race or ethnicity, Black folks occupy about 38.3% of the scale, Hispanics 30%, and white or Caucasian 28.5%. When we look at it by age range, we know that folks between 25 and 59 occupy about 70% of the scale. You guys can, next slide, please. In the state of Florida, about 506 folks were diagnosed with HIV in 2020, and these are new diagnoses. Of those, 82% were male and 18% were female. When we look at it by, again, race or ethnicity, 40.5% were Black folks, 37.9% were Hispanic, and 19% were white people. When we look at it by age range, again, between the age of 25 and 44, occupy about 54.9% of the scale, so that's on the higher side. Next slide, please. When we look at the history from 2016 all the way to 2020, we can see that the numbers kind of decreased in 2020. On the higher point in 2018, we had about 691 folks newly diagnosed with HIV, but then in 2020, it went down to 506. The reason being for that, we believe, is because of COVID. When lockdown happened, like the numbers went a little bit down. Next slide, please. When we look at it by people who were newly diagnosed, but late diagnosis, males occupied 18.3% and females 27.5%. Again, we believe that the reason why they were late diagnosed with HIV could be, reason behind that could be COVID. And then when we look at it by ethnicity and rate, we're looking at Black or African-American people between 21.5%, Hispanics 19.3%, white 16.7%. Next slide, please. When we look at the kind of the risk factors for HIV exposure, it says that the rate of Black males living with HIV diagnosis is 4 times bigger than white males. When it comes to Black females living with HIV, 16.9 rate. So that's a higher rate of contracting HIV than white females. When we look at the Hispanics, we're looking at 2.2 times higher rate for exposure. And then when we look at Hispanic females, we're looking at 5.3 times higher the exposure than white females. When we look at what is the primary kind of reason of them being diagnosed with HIV, we're looking that males who have sex with males are at 72.2%. And when we're looking on the female side, it's more heterosexual contact with 74.2%. And then of 1.2 million people in the United States and Puerto Rico who could benefit from PrEP, only 25% of those were prescribed PrEP in 2020. That is it with me. I'm going to pass that over to Gil.
Good afternoon. I'm Gil. I'm the community outreach specialist. Myths and misconceptions of PrEP. If someone is having unprotected sex and has multiple partners, pre-exposure prophylaxis, or also known as PrEP, is the best defense against HIV, the virus that causes AIDS. PrEP is 99% effective at reducing HIV when taken properly. Even so, only 1 in 4 gay and bisexual men who could benefit from PrEP use it. One reason is they are not aware of preventative medicine and how it may protect them. Even so, here are 10 common myths behind the HIV PrEP medication. The myth: PrEP is only for gay men. A fact: PrEP is for anyone who doesn't have HIV but is at risk of contracting it through sex or IV drug use. The CDC recommends PrEP if they've had anal or vaginal sex in the past 6 months and you or your partner haven't used condoms, if your partner has HIV, if you were diagnosed with a sexually transmitted disease in the last 6 months, you're a woman with an HIV positive partner who is trying to get pregnant. Myth 2: condoms are not needed if the person is currently on PrEP. Fact: PrEP prevents HIV from multiplying in the body if an individual is exposed to the virus during sex. PrEP does not protect the person from other STDs. Therefore, using condoms consistently will protect them from being exposed to the virus and other STDs such as chlamydia and gonorrhea. Another myth: it's hard to get a prescription for PrEP. Fact is, any licensed healthcare provider can prescribe PrEP. If they do not have a primary care doctor, they can visit a True Health clinic or search for a doctor through the HIV services locator on hiv.gov. Another myth: PrEP only needs to be taken after having unprotected sex. The individual must take PrEP consistently for it to protect them from HIV. Post-exposure prophylactic, or PEP, also known as PEP, is a pill that is taken after having unprotected sex. PEP is to be taken within 72 hours of possible exposure. It is very effective at preventing HIV. PEP is only for emergencies and is not a substitute for HIV PrEP. Another myth that people do say: PrEP is expensive. The PrEP medication can be expensive and can cost up to several thousands of dollars a month. Adding lab tests and doctor visits can be as much as $15,000 a year. However, the patient might not be able to pay for the specific amount. A fact is, another myth: PrEP is only for people who have had multiple sexual partners. Fact: even if you had sex with one person, it is good to take PrEP if your partner has HIV with a detectable viral load, or if you're not sure of your partner's HIV status, your partner is an IV drug user, your partner has sex with other people. Another myth: PrEP isn't needed if you're a top. The risk of getting HIV is higher for the person if the person is a bottom, meaning if they receive anal sex. If the person is a top and gives anal sex, the risks are less. It is possible to get HIV as a top. It is still important to take PrEP to protect yourself. Another myth: PrEP should be taken every day. It depends on which type of PrEP the patient chooses. Daily PrEP with Descovy and Truvada is the pill that must be taken every day. PrEP has bad side effects. PrEP is safe. Most people don't have any side effects. Most of the side effects are mild and can include headache, nausea, diarrhea, tiredness, rash, belly pain. These go away after you take the medication for a period. Rarely, long-term use of PrEP can cause liver, kidney, and bone problems. These medications may not be safe for people who have liver or kidney disease. And last but not least, the last myth: a patient will need to stay on PrEP for the rest of their lives. The patient can go off PrEP if they are no longer at risk for HIV. The patient should ask the doctor on how to safely stop taking these medications. Daily PrEP, the patient can stop the pills after they've taken 2 daily dosage or 28 daily dosage after the last exposure of HIV, offered at True Health. And next off, I will pass it back to Dr. Mel.
Thank you. Thank you so much, Gail. Very useful information. So next, I want to talk to you all about some common sexually transmitted diseases. However, before I get into that, I just want to kind of brief you all on behavioral health and risk modification as it pertains to PrEP as well as sexually transmitted infections. As Jafet mentioned at the beginning, here at True Health, we do offer behavioral health, and we have been able to use those services to link it with our PrEP program. Now, as Gil said also a moment ago, you don't have to be on PrEP forever. So our mission with our behavioral health team is to help all of the patients on PrEP to modify their risky behaviors and get them out of that risk zone so that they can come off PrEP. It might not be the case for everyone, as there might be someone that has a partner who's HIV positive, and that person is more likely to remain on PrEP. But behavioral health linked to PrEP is very, very important, not only to us, but to the community, because this is the way that we try to keep everyone safe and to reduce their risk factors. So as far as sexually transmitted infections, we all know that we do have several out there. Just to mention a few, we do have the trichomonas, gonorrhea, hepatitis, herpes, HIV, HPV, which is a human papillomavirus. But today, and syphilis as well, but today I'm going to focus on three of the major ones that are affecting more Central Florida. And the reason we decided as a group to address these to you all is because these numbers seem to be spiking here in Florida. And these infections are chlamydia, gonorrhea, and syphilis. Can you change my slide, please? Thank you. So sexually transmitted diseases, also known as sexually transmitted infections, they are all very common. Millions of cases reported daily in the United States. And as you all know or may not know, but these sexually transmitted diseases can be given to one another through vaginal sex, oral, and anal sex. Next. Symptoms that you can experience with any of the sexually transmitted infections that I mentioned. And these symptoms I'm about to go over does not pertain to every single one of them, but I want you all to just have a general idea that if you notice having any of these symptoms or any of these signs or rashes, that you should consult with your healthcare provider. You can experience unusual discharge from the vagina, penis, or the anus, pain when you urinate, lumps or skin growths or rashes in your genitals, as long as also as in the anal area, generalized rash, unusual vaginal bleeding. You can also have blisters and sores around your genital area, and also warts around your genital or anal area. Next, please. So chlamydia and gonorrhea, I just want to, like I said earlier, I want to focus a little bit on these two as well as syphilis, because we do have a spike in the infection rate here in Florida. So we thought that it would be convenient to educate as many as we can and just get the information out to you all, and you all can share it with your friends and neighbors and family members and anyone else you think might benefit from this information to keep them safe. So chlamydia and gonorrhea, very common among men and women. And the thing with these diseases is that if left untreated or unnoticed, it can cause permanent damage to a woman's reproductive system. So this would make it difficult for women to get pregnant, or difficult for them to keep a pregnancy, or give them at risk or put them at risk for an ectopic pregnancy. So those are the risk factors when you have these infections and you don't get treated. And next, please. And if you don't get treated, then obviously it can make it difficult to keep a pregnancy or become pregnant, like I said. So as far as chlamydia and gonorrhea, yes, they are spread the same ways that I mentioned at the beginning. It could be vaginal, anal, or oral. If you are exposed to someone that has the infection and you're having unprotected sex, then yes, these are the risk factors that you can get these two diseases. Also, pregnant women that have active disease, active infection with chlamydia and gonorrhea can actually pass it on to their newborn during childbirth, during vaginal delivery. Risk factors, and this is important. This is one of the most important points of this presentation, is that to educate everyone on risk factors so that you can minimize those risk factors and get yourself out of this risk zone of getting infected with these sexually transmitted infections. So risk factors for getting infected would be if you have unprotected sexual activity, if you are sexually active and you started your sexual activity at an earlier age. And the reason for that could be behavioral as well as some biological factors. Gay and bisexual men are also at risk since infections can be spread through oral and anal sex. If you're younger than 25 years of age, and if you're younger than 25, if you're 25 years of age or older with the risk factors of having multiple sex partners or having a partner with sexually transmitted infection, or if you yourself have been diagnosed with a sexually transmitted infection in the past, that also puts you at risk. Next. So for females, as far as symptoms go, females can have an abnormal vaginal discharge and or burning sensation when they urinate, or even sometimes not when they're urinating, and also vaginal bleeding in between their periods. For the males, they can have a burning sensation when they urinate. They can have pain and swelling on their testicles or even on the head of the penis. And also they can have a white or yellow or green discharge from the penis. Next. The rectal infection symptoms, as I said, men and women both can get chlamydia and gonorrhea in the rectum if they are actively having unprotected anal sex. And so some of those symptoms can be rectal pain, rectal discharge, bleeding, anal itching, soreness, and painful bowel movements as well. Next. So how do we diagnose and we treat? Well, the first thing I want to let you all know, and if you can walk away with anything today, is if you notice any symptoms, anything strange, anything is off, you all know your body better than we do, right? Than the healthcare providers. So if you notice anything, the first thing you need to do is you need to seek treatment. You need to seek a healthcare provider so that they can assess you, examine you, and test you. And so different forms that we can diagnose the chlamydia and gonorrhea, that would be through genital or oral cultures, and that would be depending on your symptoms. If you say, well, I have a vaginal discharge or I have a discharge from my penis, then we would take cultures from there. Or if you have any symptoms orally in your mouth and you say that you have been active orally sexually, then we would take cultures as well from your oral cavity. Also, urine test. In urine, we can detect chlamydia as well as gonorrhea. Treatment is really going to depend on which one of the two you have. Some people might get both of these treatments, oral antibiotics, as well as an injection with antibiotics. Next. Okay, so now syphilis. We're going to, as I said earlier, discuss syphilis because syphilis is one of these infections that, believe it or not, we're seeing a spike here in Florida. And what's even more sad, and we really need to tackle this, is that we're seeing high numbers, rising numbers in congenital syphilis, meaning babies that are born with this infection because it's passed to them via the mom during pregnancy. So syphilis is a multi-systemic disease. It's, I mean, I can sit here for hours and talk about syphilis, but of course we're not going to do that. So I have shortened it. And I want to give you the most important points so that you all know if you come across symptoms or if you know someone that mentions anything that sounds familiar, you can say, hey, well, you need to get checked out. So syphilis has 4 stages. It's got a primary, secondary, latent, and a tertiary. It is obviously a sexually transmitted disease, and without treatment, it can cause devastating health problems in the future. So each stage of syphilis comes with different signs and symptoms. Next. I'm going to focus today on your primary and secondary because these are mostly going to be the signs and symptoms that I want you all to keep in mind if you notice or if you know someone that they need to seek attention from a healthcare provider. So syphilis, as well as the other STDs I mentioned earlier, can be spread through a sore during vaginal, anal, or oral sex. It can also be transmitted from mother to their unborn child. How you're not going to get syphilis, and this is something that a lot of people think out in the community, and it's misinformation. You cannot get syphilis through toilet seats, doorknobs, swimming pools, hot tubs, bathtubs, or sharing clothing or eating utensils. This is not how syphilis is spread. It's going to be through a sore during vaginal, anal, or oral sex. Next. Risk factors for syphilis infection. If you're a person that has HIV, you are at risk. If you are taking PrEP, pre-exposure prophylaxis for HIV, and I will tell you the reason why. I don't want you to get confused. If you are taking PrEP because you're going to prevent HIV, some people are still having unprotected sex. Therefore, that increases their risk of contracting syphilis as well as the other STDs I mentioned earlier. So it's not that you're gonna have higher risk because of PrEP, it's because of the unprotected sex that comes along with taking the pre-exposure prophylaxis medication. And of course, if you have a partner who have tested positive for syphilis in the past, that is also a risk factor. Next. Signs and symptoms, as I said, syphilis has 4 or 5 stages. I'm going to only concentrate on the primary and secondary phase. So in the primary phase, this is a phase where you're going to notice either a single sore or multiple sores. And normally your first sore you would notice at the actual spot or place in the body where you came across in contact with the person that had it, right? So it could be penis, vagina, anus, rectum, or lips, or inside the mouth. That is your primary phase of syphilis. So it's more so with a skin lesion. Your secondary phase of syphilis, you can have skin rashes, sores in your mouth, vagina, or anus in one or more parts of your body. So at this stage, you can see that the rashes or the lesions can spread. So it's not just concentrated in the one spot where you were exposed. Can actually spread to other places. You can have different stages of healing. You can have some of the sores that look like they're healing, and some look like they're more recent. And also, this is the stage where some people can notice these rashes in the palms or the soles of their feet. Next. Diagnosis and treatment. Again, you know, if you walk away with anything here today, I want you to remember, if you notice any of these symptoms or signs that I've mentioned, please look for your healthcare provider. You need to seek medical attention. I understand Google is a thing now where people go and Google symptoms, but you need to seriously go to a healthcare provider so that you can get properly diagnosed and you can get treated, because all these diseases can have devastating outcomes if left untreated. So how are we going to diagnose syphilis? It's going to be through blood test. Okay, so your primary care provider can do a blood test to test specifically for syphilis. Also, they can do it through testing body fluids from your syphilis sore. Most commonly, though, we tend to go for the blood test. How are we going to treat syphilis? Syphilis injection medication is our #1 mode of treatment. However, some people might be allergic to that injection medication that we use. So in those cases, we would go to oral medication to treat it, okay? So once you get syphilis, it does not mean that you're protected forever. You can actually get it, get treated, and you can get it again if you have unprotected sex with someone that has it. So getting it once does not protect you. After you are treated successfully with this disease, you need to make sure that you follow up with laboratory work. So in your blood work, it would confirm whether or not you have been cured. And that's very important. Some people might take medications, feel better, and they don't go back to the healthcare provider. And if that happens, but you're not fully cured, then again, it's like not having been treated in the first place. So it's very important to finalize that treatment phase by going back to your healthcare provider for that final blood test to confirm that, yes, you have been treated successfully, or if you need more treatment. So that's very, very important. Next. And these are some references here I put. Centers for Disease Control and Prevention has excellent, excellent information for the public regarding all sexually transmitted diseases. You can also go to the Florida Health Department. They also have a lot of good information on these diseases. They also have statistics, and they also have resources where you can go if you do think or you come across someone that has any of these infections and need healthcare attention. So with that, I am going to go ahead and pass it over on to Bernadette. She is our HIV case manager, and she will talk to you about PrEP.
Hello, everyone. We at True Health are excited that we've been funded by HRSA to offer the PrEP program to everyone at no cost to them. So when the medication's taken as prescribed, it's highly effective. It's 99% effective from catching HIV. It is FDA approved, and the name of the medications are Descovy and Truvada. So is PrEP good for you? Is PrEP program, is it something you think that you would want to do for yourself to protect yourself from catching HIV? Well, some of the criteria would be if you've had unprotected sex in the past 6 months, you don't regularly use condoms, you've been diagnosed with an STD in the past 6 months, or even if you have shared needles or syringe or any equipment to inject drugs in your system in the past 6 months. So to stay in the program, to join the program, the requirements at True Health, you would need to see one of our True Health providers. You would have a blood work done every 3 months, as well as PrEP counseling every 3 months. We want to continue to counsel you to make smart practices when you're having sex. Now, keep in mind that PrEP program and the medication that you would be put on by one of our providers does not protect you from catching any other sexual diseases. It just protects you from HIV. I look forward to working with you guys if you guys decide that you do want to join the PrEP program. Again, it's at no cost to you because we have been funded by the government. I will kind of be like your right-hand man. I am the one, will remind you about your doctor's appointments and schedule all the needed appointments that you need to have in order to stay in the program at no cost. All right, I will send it back to Dr. Mena.
Thank you, Bernadette, for that information. So if any of you are interested or need or want more information for yourself or to share it with anyone else, you can go ahead and log into our website, www.mytruehealth.org. We do have a website with a lot of information as it pertains to all of our services. We also have a dedicated page to PrEP, so you can get information if you wanted to sign up and set up an appointment to see a healthcare provider or talk to someone about PrEP. I just want to let you all know once again that this is not all that we offer at True Health. Just like Jafet mentioned at the beginning, we have healthcare providers here and we provide primary care, pediatric adult medicine, mental health, podiatry, optometry. We have dentistry. So if you all know someone, a family member, a neighbor, or anyone else, or yourself, please go ahead and reach out to us, and we definitely are here to provide those services to you all. So right now, we want to open up the forum for any questions, any comments, any concerns, anything that you all might be wondering about, or something that we didn't cover, or if you have any questions on our services, we're going to open it up for that now. And also, don't forget to complete that short survey, and then you will be able to enter to win a $50 gift card. Okay, so we have a question. And it looks like the question is, what is the best way to talk to your kids about STD prevention? That is a very good question, because this is a subject that a lot of parents, we struggle with it. We do struggle with it. But for every age range, there is ways to address different things. Resources out in the community for that is in the Florida Department of Health. They have a nice website that talks about what you should be addressing with your children and at what particular age. So one of the things that we always have to keep in mind is always be honest with the kids. Always don't give them the myths or, you know, the birds and the bees stuff. We need to be honest with them, because it's real, you know, and these diseases and risk factors, they're real. So the last thing that we want is for our kids to go out with myths. You know, we've all heard myths from our parents when we were younger, but you know, you need to make sure that you listen to your child. So if there's something in particular that they're asking, or if there's something that they saw or that they heard, right? Because we also, depending on their age range, we don't want to go overboard and overwhelm them in just one sitting of answering one question. So always is a good idea to also talk to your child's provider, as sometimes small children might feel more comfortable with talking to a stranger. In this case, it could be their healthcare provider, believe it or not. So it's important to make the child feel as comfortable as possible and not to give more information than what they should know at that age during that one, you know, sitting of talking. So it's almost like a transition, and it's good to keep that in mind so that we don't overwhelm them or scare them, unless of course they've heard things from friends, or they saw something and they're confused. Then we definitely need to address this and keep it as honest and clean as possible. Okay, so there's one question here, and the person asks, is PrEP safe when you are breastfeeding? PrEP is, number one, safe for women that are pregnant, and women that are breastfeeding also can continue on PrEP. What we do here in True Health is that any woman that is pregnant and is on PrEP, we refer them to more specialized medicine. So they are referred to maternal fetal medicine, where they get closer monitoring of their pregnancy and being on PrEP at the same time. Also, when they are breastfeeding, these women still continue to see specialty healthcare providers that can guide them to continue PrEP as well as breastfeeding. So there is no harm. They can absolutely do it while they're taking PrEP. And Gil, it looks like there is a question for you. So I am going to let you go ahead and answer.
Okay, so it looks like the question is, how can we in the community help spread accurate awareness about PrEP? One of the things I will say, something I learned recently, PrEP has been around for over 20 years. That's something that, again, I just learned recently, and I feel like a lot of the organizations that I've spoken with or met with, they have that same question in regards to how can we raise more awareness. At the end of the day, it is 2023. Whether you're sexually active or high risk or not, you might or know someone that is, or showing those high risk behaviors. So it's just appointing them to the resources that you know of, or even the health department, or even the CDC. And if not just True Health, but I will say there are a lot of resources. So it's just engaging in the community. If you're ever at a grocery store, or if you're at the doctor's office, and you're just, me, I can spark up a conversation with a stranger. And if I hear something that I feel like I have information that I could provide to them, I'm going to do that. It's just pretty much just being educated on the resources that are available in the community, and just letting each organization know, as example, True Health does have a program. It is federally funded, so it's at no cost to the patients, covering lab work and counseling sessions and everything like that. So it's just making yourself aware and collaborating with other organizations as well. I find that to be very effective. Sometimes we may have a clientele that other organizations don't have, where those clientele from those organizations can benefit, or they can refer those clients to us.
Thank you, Gil.
You're welcome.
Thank you. So I want to just mention a website that Giovanni has mentioned to us as it pertains to helping to talk to your children about sex, and that is todaysparent.com. So if you go into that website, it will give you some tips and pointers and some good information on how to address this so sensitive topic with our children. And we are looking out and awaiting for some other questions. Okay, so it looks like we're probably going to.
Hi, Dr. Min, I'm sorry, I see one question here. It says,
Oh.
if I forget to take a pill one day or several days, does this affect the effectiveness on my system?
Thank you. No, if you forget to take one pill or even two, it should not affect. However, it also depends on when in your treatment this occurred. If this occurred at the very beginning, when you started your treatment, you wouldn't have been protected fully anyway, so you would be at more risk. But if you're well into your treatment and you miss one or two, the most important thing to do is to continue taking the medication as scheduled daily. Now, if you're having issues where you're remembering several times a week, then this medication will not be effective. Remember, in order for it to be effective, it's got to be taken as prescribed, one pill, one a day. So forgetting one dose, maybe once in a while, maybe one a month or every 3 months would be okay. However, if this is consistent in your taking your treatment, yes, this will be a problem because you will not be fully protected against getting HIV. I'll give it one more minute in case there's any other questions. Okay, so someone is asking, how can I get off PrEP after starting? Well, getting off PrEP after you start, there's no set guidelines per se. You don't have to weigh yourself down or anything. However, the best way to get off PrEP is always to talk to the provider that's giving you the PrEP medication, to make sure that they're giving you other instructions to keep yourself safe. If you haven't already went through or gone through the behavioral risk modification counseling sessions that we offer here in True Health within the PrEP program. So as I said earlier, some people might, it comes a point where they say, well, you know, I've modified my risk behaviors and I'm no longer at risk, so I'm going to get off PrEP. That's fine. The best way to do so is to make sure you get those final laboratory tests to rule out any STDs, any other sexually transmitted infections, and you know, and getting off, and of course continuing to practice safe sex if you were to step out of the relationship, or if you were to have sexual activity with a different partner. So there's another question, and it's a very good question. Is PrEP safe with other medications that you take daily? Yes, PrEP is safe with other medications. The only medications that we need to make sure you talk to your healthcare provider if you're taking them is medications for hepatitis C or other antiretroviral medications. And if you were taking other antiretroviral medications for HIV, then you wouldn't be taking a PrEP medication. But those are the only two instances. So if a person is taking medications for hepatitis C, they'd have to talk to the healthcare provider, make sure they let them know which medication it is they're taking, because yes, there is a couple, maybe 2 or 3 hepatitis C medications that can actually interfere with Descovy or Truvada. Okay, so, all right, guys, so we're gonna go ahead and close it up here. I really hope that we answered your questions today. I hope you got something out of this informational session, and I encourage you all to continue looking for more information as it pertains to sexually transmitted infections and PrEP. We want our community to be as safe as possible, and we're here to help you accomplish that. Don't forget to complete that short survey. It's only 5 questions. And you should have a link to that already. Oh, there it is. And so what we will do is we will get back to the winner. We're going to draw, and this is going to be randomly, and whoever wins will reach out to you and provide you with a $50 gift card. I thank you all for attending, and I hope to see you soon in our next 2 events, which will be May 24th and June 21st. You all stay safe now. Have a good day.